Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello everyone, thank you for joining us for this week's Partner Talk. My name is Jan Ngozo, a biomedical engineer for the Oxygen Alliance, and I'm speaking to you from Milongo, Malawi. So for our new members, the Oxygen Alliance brings you oxygen talks and partner talks that are tailor-made to equip biomedical engineers and any other professional in the health sector with knowledge on oxygen-related equipment. So if you're joining us for the first time, be free, feel welcomed. So please, I'd like to know where you're joining us from. So please, you can type it in the chat, your location. And for our new members, if you're interested in staying updated and receiving invitation to our future partner talks, you're welcome to share your email addresses in the chat so that we can add you to our emailing list. So presenting to us today is Ari Karid and Christine Weri, engineers from Hash Technology. So they'll be presenting a very interesting topic on reducing medical equipment, downtime, and equipment graveyard with comprehensive technical support. So we'll have a chance to ask questions at the end, or if you have another question, you can type them in the chat. So make sure you take some notes, write something down so that at the end you can ask questions. So without wasting much of your time, I hand it over to you, Ari and Christine.
Thank you. Thank you so much. My name is Ali Khalid. I'm a biomedical engineer by profession. And I'm with my colleague here, Christine Were. I'm the Director of Technology for Hatch Technologies. We are sharing our experiences today about what we are able to do the past 4 years as Hatch Technologies in terms of reducing medical equipment downtime and equipment graveyards with comprehensive technical support. I'll let my colleague Christine introduce also herself.
My name is Christine Were, a biomedical engineer in Kenya, and currently I'm working with Hatch Technologies as the customer support associate, and mostly I want to provide technical support to our customers in Kenya, Malawi, Tanzania, and Nigeria. So welcome to the call, and we look forward to engaging you guys and sharing with you what we do at Hatch and how we ensure that all the devices that we distribute and install remain functional for the period of time that has been allocated for its lifetime, to ensure that there is maximum impact in terms of managing newborns and mothers in hospitals. Yeah, so welcome, and I look forward to a very interactive session today.
So you can go to the next slide. I'll introduce slightly who is Hatch Technologies, so that perhaps you understand how we are able to take care of these devices and support the devices in the hospitals. So Hatch Technologies is a non-profit organization that originated from Newborn Essential Solutions Technologies program, in short, NEST 360. Some of you might have heard in the countries that we are operating at in Kenya, Tanzania, Malawi, and Nigeria. NEST 360 is an international alliance of 16 organizations who are working with governments and other stakeholders in the healthcare to end preventable newborn deaths in African hospitals in support of the SDG 3.2. So how does NEST and Hatch, how do they want to end preventable newborn deaths? They are approaching it in different ways, and some of the ways include delivering and sustaining innovations. And by that, we mean we test, we qualify, and we distribute a package of newborn health technologies for low resource settings. So the other way is to develop an education ecosystem. Here we are training biomedical engineers in the college, in the university levels. We have partnered with different universities across the 4 countries and colleges to train biomedical engineers so that they are able to understand these technologies in their curriculum, so that when they come and practice the biomedical engineering field in the hospitals, they have encountered these devices already and able to solve them. The other team who gets this education is the clinical, because without the users understanding these devices very well, there is this risk of not making most usage out of them, and there is also risk of misusing these devices. So you have to train the users very well. That includes the doctors, the pediatricians, the neonatologists, and the nurses. And this education is not only just on how to use the devices, it even covers all areas on how to take about these small and sick newborns. The other one is, of course, collecting data and implementing evidence-based care. Nowadays, you'll find Ministry of Health, for them to take action, the actions has to be backed up by data, by evidence. And in Nest and Hatch Nest 360 and Hatch, what we have been doing is we have been collecting data, both the clinical data and data from technical data from these devices, so that we can prove a case and inform the decision makers in these ministries of health and governments. But mainly, as Hatch Technologies, our work is around delivering and sustaining innovation. So we normally don't deliver any sort of devices, or we don't distribute any kind of devices. We do normally select them. Remember, our target is to reduce device downtimes and the medical equipment graveyards that we have seen in hospitals. But to do that, you have to prevent, first of all, in the beginning. So for us to prevent us ending up with low quality devices, what we do is we select very high quality devices, and all the devices that we select go through a 5-step qualification process. And this process actually includes identification. We work with distributors, and we look at products which are well established in these areas that we are working, and products actually that are doing well in the low resource settings. That is identification part. Then we forward them, or we put them actually in a landscape document. Then we compare them. The second step is target product profile comparison. We compare them with a set of specifications which consist of both minimum specifications and optimum specifications. And these actually target product profiles has been co-developed with UNICEF, and we are working actually with ministries of health in various countries so that they can adopt. For example, you'll find that they want to tender medical equipment for newborn units across the countries, or across the different public hospitals in that country. Then the Ministry of Health needs guidance on which equipment to procure or buy. Take an example of the phototherapy device. There is the LED versions, and there's those ones which use the fluorescent tubes. Which one is the most recommended? Which has the best, gives the best life cycle value? So we advise the Ministry of Health to help get the best products, and in the target product profile, once that, for example, a new product goes through that TPP comparison and it is okay, and here also it includes checking whether this device has CE mark or FDA approval, because we don't want to qualify substantial products. Then it goes to the next process, which is technical testing. And this is done actually by our partners in USA, RISE 360. They take it through technical testing. This includes, for example, even oxygen concentrator. The manufacturer is saying it gives 93% pure oxygen. And we normally do tests with different various testing equipments to make sure that this is what the manufacturer has written or said, and this is what we actually were getting. We do the electrical safety test and all those. Then if it passes that, it goes to the other stage of environmental testing. Actually, this involves putting this device in a dust chamber where it's exposed to, dust, high humidity, low humidity, high temperatures, low temperatures, just to simulate the kind of environments, the tropical settings that you'll find in Africa or in some parts, so that these devices are rugged and robust and they don't, break easily or just get affected by the slightest environmental issues like humidity and temperature changes. If the device passes that stage, then it goes to the last stage, which is usability testing. And this is done actually, for now, it's being done in Malawi. And what happens is, if there are two devices which were getting qualified, they both end up in, Malawi and one of the big hospitals there, let's say Queen's KCH Hospital. And the nurses, they are very experienced nurses, are given these devices. And what the people who are doing the testing are looking out for is how easy is it to use this device without prior training. There is, of course, a certain small training which is done before this test. And then the nurses are tested on how easy they can use the devices without prior training. The assumption here is that the public or the low resource setting hospitals cannot afford the type of trainings and retrainings that you will get in some of the top private hospitals. So we want these devices to be used with minimum, training, or a new nurse or from school or a new nurse from different hospital can easily just use this device without, causing major issues or in terms of breakage or misuse for this device. If the device then passes that final test, it's able now to get qualified, and we call this device NEST qualified. And actually, you'll find some of our NEST qualified devices in the UNICEF product lists. So it's kind of a quality mark for us, and it has really guided us this process in terms of acquiring very robust devices. Some of you who know the Pumani CPAP, it's very, rugged, robust device, which requires less attention because it's just a bubble CPAP compared to what you will get with those electronically driven CPAPs, which need a lot of attention, the touch screens getting faulty and all that. So that is in terms of getting very good quality devices. You can go to the next slide, Christine. Hatch Technologies works in different regions. For phase one, we are working in Kenya, Tanzania, Malawi, and Nigeria, and we work with local distributors, which you can see in the screen. Nigeria, we work with JNCI. Tanzania, we work with a company called Another. Kenya, we have two distributors, one for the public, one for the private, PT Healthcare and Mediglobe Solutions. Malawi, we're working with a company called Elite Biomedical Engineering. And for phase two of the program, Hatch is going to Ethiopia, Ghana, and one more country, which is either Uganda or Zambia. The green shaded countries you can see in the map. Can go to the next slide. So some of the products which some of you might be very familiar with include the phototherapy light. We actually have two models for each device, just so that we have sort of a backup model in terms of logistics and all that. So we deal with the Phoenix phototherapy and Colibri phototherapy. We have the warmers, the Pumani CPAP, the flow splitter, all that. Some of you might have seen them already in the hospitals, the syringe pumps. All of these have gone through the NEST qualification process, and they are NEST qualified. For the concentrators, we deal with 3 brands, ASEP concentrators, and Longfian and Kanta. Yeah, those are the products we have. Just mentioning so that you understand when we mention how we support them, you can relate to them. Go on to next slide. So how are we supporting these devices? You'll find that actually 40% of this device medical equipment end up in medical equipment graveyards. The term graveyard might be a bit, scary, very big word, but it is that way. As you can see, these pictures, a lot of medical oxygen concentrators stacked somewhere in a workshop. And this is actually what the picture that you will see in many of the hospitals, especially the public hospitals in different countries across Africa. This is something all the biomeds are familiar with. So our main actually talk today topic will surround this and how actually us as Hatch Technologies, we are trying to reduce the number of devices that are ending up in these medical equipment graveyards. So this is a statistic, the 40% is a statistics from WHO actually. And you might wonder why is this happening? So some of the reasons is there is mismatch in technologies and the local needs. You'll find that there's a district hospital which just needs a very small, bubble CPAP because the nurses there are the ones who are going to use, and even a pediatrician or a neonatologist is not able to come there for one reason or the other. Then you'll find that there is a donation from somewhere, or even the government has purchased a very high-end equipment which can only be used in top private hospitals in the capital city because it needs enough power. First of all, it needs very good training because it is employing things like touch screen and a lot of features here and there. So you'll find that what the locals needs is not what has been delivered. So there is mismatch in the technologies and the local needs. Then there is broken supply chains. You'll find that some devices are lying in the workshops just simply because there is no enough consumables or there is broken supply chains in such a way that the spare parts that is needed for this device cannot be gotten because just some of the companies that the hospital was dealing with imported these devices, and there is not enough of such devices in the country to get spare parts or enough stock for the spare parts. Then the other bit is training, and that's why we mentioned the training aspect of NEST the other time. Training here both for the users and the technicians. So if there's not enough training or there's lack of training, then it can lead to misuse of these devices. And some parts can get broken and they just easily end up in the medical equipment graveyards. Or even the biomeds, if they're not well trained on how to repair these devices, you'll find these devices just lying in the workshops. So my colleague Christine will take us through in the next slides on how we don't want to be part of these statistics and how we reduce these statistics on our part in these 4 countries that we are working in. Welcome, Christine. I think you're muted. You're muted.
Yeah, apologies for that short delay. So I was saying thank you so much, Ali, for that wonderful introduction on what we do as Hatch, also on the type of equipment that we deal with, that is for newborn and maternal, and also for touching on the statistics for medical equipment graveyards in sub-Saharan Africa, because that is what is going to be my main topic of discussion as we move forward. I'm going to share with you guys two different solutions that we have for monitoring and tracking our devices to ensure that any installation that we have made in all the 4 countries that we operate in, the equipments remain functional. So let's delve into the solution aspect. So number 1, as an organization, we have ensured that we have a comprehensive web-based application to track our devices. And this this web-based application is called Asset Infinity. And using this solution, we can track our devices from the point of shipment once we identify the devices that we want to buy. So we track them from manufacturers, from the manufacturer warehouse that they have been shipped. And then we follow our devices to receiving and storage, that is in terms of warehousing and also inventory management. We still use the same software. And after inventory management, of course, once you have the goods in the warehouse, you want to start installing in different sites. So as the process of installation happens, mainly conducted by our biomedical engineers with our distribution partners, we still track those devices in the sites where they have been installed. Then from installation, we will track also the device status. We'd want to know, is the device working? Is it not working? Is it down? And also, is it in use with an issue? For example, you have an oxygen concentrator that is still functional, but maybe you lack oxygen cannulas or some consumables that you need. Or you have a pulse oximeter that you can use only for newborn, but you can't use for adults because maybe you lack a probe. So any device that is still functional, it can be used, but it needs to be fixed. So we still track devices in those 3 categories: devices that are working, devices that are in use with issue, and also those that are down. And I'm happy today because most of us here are biomedical engineers, because with this software, mostly we rely on the feedback from biomedical engineers in the different sites. So we have created a very good rapport and a networking that they can relay to us this information whenever an equipment breaks down or they have an issue with supplies or spare parts. Then they let us know. We will update on the software and we can use it now in terms of decision making, the kind of devices that we need, spare parts, consumables, in terms of different types and also quantities. And another thing, this software, we also use it in labeling devices when we want to decommission, end of life. For example, the lifespan of a concentrator is 5 years or 6 years. Once it has been used for that period of time, then we'll need to decommission it. That the concentrator right now is 5 years, not unless it's still operational, but we'll always want to label such kind of devices. So one of the benefits that this technology has proven, number 1, is smooth supply chain through stocks level visibility. And since I have this software we have this software in our laptops, you can always check each and every time. If you ordered goods maybe from Vietnam, you can always see tracking number. You can always know they're in shipment. Once they arrive at the warehouse, you'll be notified that your goods are here. And even when the stocks reduce, we will update that data to ensure that when you are making plans for restocking and buying more devices, we use data from Asset Infinity. And another wonderful aspect with this software is that we can record the technical device issues to establish trends and give quick support. As a biomedical engineer, in the cases where you walk into, for example, an ICU or a ward, then you realize that a device has broken down, it's not in use. So what we advise our engineers to do is to record on this platform that device with this serial number has broken down, and you can even take pictures. What happened, and then you'll open a ticket for that device. From my end, I can see that David, a biomedical engineer, for example, in Kamuzu, this Kamuzu Hospital has opened a ticket for 2 concentrators or 3 concentrators. And from this data, I can know how to support them. Do they have enough spare parts? Do they have the technical know-how to repair, or do I need to support them? So I'll identify a way of supporting now our field engineers. This is just a depiction of how it looks like. For example, in this image, these are tickets that were raised by our engineers in different hospitals in Kenya. So if you can see the image, you have the one that is in black showing tickets that are closed. That means that particular facility, for example, facility 1, had opened 4 tickets at that particular time, and all those issues were resolved and the ticket was closed. And the one with blue is tickets that are still open, they're still pending. That means we need to repair the devices or decommission if at all it is not functional again. And one good thing with this kind of data is that it helps us now to have a close loop communication with our biomedical engineers. They can record, and from here we can support them very well. And we have the same data even for Malawi, Nigeria, Tanzania, and even Malawi. So this is one of the solutions that we have, a software for tracking devices from shipment to installation to any breakdown, that is device status, and even recording tickets. And from these tickets, actually, we have been able to analyze trends. Like we have found out that a certain model of concentrators, for example, is always breaking down. So from this data, we can follow up and know the exact problem and even relay this information to the manufacturer. So it has been a very useful tool, especially in keeping trends of technical issues and also making sure that the biomedical engineer, as myself, that I am accountable. If a device has broken down, I should take minimal time to repair it, if at all I have the necessary spare parts that I need. And using this software, we've been able actually to maintain an uptime of 98% of most our devices, because we are always aware when it has broken down and we can support in quick repair. Therefore, ensuring that the uptime of most of our installations is over 90%. So that is the first software. I'll move to the next one. If you have any questions on this one, you can write them on the chat section, or at the end of the presentation, we'll have a chance for you guys to ask questions. So allow me to move to our next section. So apart from the Asset Infinity, which is a web-based system, we have another technology, actually the newest in our organization, called Hadley Monitoring System. This is a medical equipment tracking system that monitors medical equipment. So with Hadley, we always want to know whether the equipment is useful or not. A good example, I'll use an example of an NGO like Save the Children. For example, Save the Children has donated 50 devices in a hospital. And for the purposes of tracking impact, they want to know whether the devices are functional or whether they're being utilized. We've seen cases where a hospital has new equipment, they have never installed, they never use them, or even they broke down and they don't repair. Actually, what we are talking about, equipment graveyards. So with Hadley monitoring system, we can measure the device utilization details, and we can also use this technology to know the environmental status. And since most of our devices are for newborn, You know, this is a very critical environment, and the temperature and humidity needs to be monitored very well. So this technology, we can also monitor environmental status. And even away from the newborn unit, there are other areas in the hospital, for example, the cold rooms, that will need to monitor aspects like temperature. And even in CSSD environments, you always want to measure temperature or humidity. So for Hadley, we've been using it to measure device utilization and also to tell the environmental status, that is temperature and humidity. So this technology, it automates the identification of device issues in the hospital and prompts with notifications the electrical support team for action. And I'm happy that we'll get to see, I'll get to take you through step by step on how it works and the advantages it has and how the success that we've seen so far. So a case example or a case study is at Kamuzu. I just used this image for you to see the kind of data, like an example of what we get from Hadley. So for instance, at Kamuzu Central Hospital, right now, we are monitoring 17 of their newborn devices. And when I was taking this screenshot, 7 of them have been off for at least 7 days. That means whichever the type of device, be it a CPAP or a concentrator, seven of the devices had not been used for at least 7 days. So what that means is, as an engineer, I'd want to know. I understand maybe Kamuzu is a busy hospital, and I'm seeing that a CPAP has not been switched on for the last 7 days. Is it that it has broken down? Or is it that the patient traffic is a little bit low? So it's always, it will always help you to raise concerns and also to understand like utilization of the devices in a facility. And now when you bring it back to our bigger picture of reducing neonatal mortality, it can actually help you to see if at all the devices that you've donated or the devices that that hospital has, whether they're using them well or they have not been trained on how to use them, so they lack confidence. A device has never been used, whether it has broken down for so long and no one has touched it, or maybe you have even shifted the location. The device is no longer in the newborn unit. So we can always tell from this data. And then when you move to the second box, we can see now the current system status. In that one, we'll get to understand more about the system, how the system looks, how the innovation. I'll break down the innovation. That at any point in time, I'll always know how many gateways are online or those that are offline. And when a gateway is offline, that means I'm not able to track. So, but we'll get to see that in the next slide. And another thing, we will also track utilization changes. For example, if this week a CPAP was not functional, maybe we expect next week it should be functional. If at all, the problem was with traffic. Maybe traffic was low last week. Very few babies were born in that unit. So following the other week, the next week, we'll also want to know, has the utilization status changed? Has it increased or is it stagnant? Then that can help you also as a biomedical engineer to know or to ask questions from the users whether these equipments are still functional or not. So this is a very good tool actually for biomedical engineers, because most of the data that you'll get from this tool is technical data that can help you monitor all your devices in a facility. So I know you might be wondering, and how does this function? How can I know that this device is functional? Or how am I able to tell that they have never switched it on? So from this slide, we'll get to go through it. The Hadley monitoring system, each component, functionality, and how they interact. So number one thing, I'll start from the left. So be keen to follow. So we have a gadget called a device monitor. It's very small, like the size of a mouse. So this device monitor, will attach it to the device. I hope you can see this Let me use the pointer. Yeah, I hope you can see this concentrator over here, this last image. So this is how the monitor is attached to a device. You will attach it or connect it to the power input part of the device. Then from the monitor port, you'll connect the device directly to the socket. So this is how the device monitor looks, and this is an oxygen concentrator, and that is how it has been connected. And then on the left, we have now the device monitor. And since we are dealing with the NBU or newborn unit, we want to measure the humidity and temperature of that room. So you'll also have a very small sensor for humidity and temperature measurements. So these two sensors will be collecting data in terms of utilization, whether the machine has been switched on or not, especially now for the device monitor. It will collect for you data to know whether there's current flowing to the machine, whether the machine has been switched on or not. And of course, we are engineers and we understand the aspects of power, voltage, and current, that there's a threshold that you will be able to detect whether a machine has been switched on and is actually drawing power. That means it's being functional, it's running a pump or not. So we have a threshold of current that you'll want to detect to know whether that machine has been switched on and has been in use. Then for the temperature sensor, of course, it's just going to collect data on humidity and temperature so that you can monitor. They should not go beyond the specified range for newborn unit. And if you're using the technology in any other area of the hospital, you'll also have the set ranges for humidity and temperature that should be maintained. So these two sensors will connect now to a cellular gateway through radio communication. And that means they should be in a specified environment like circumference. So there's a limited distance at which they can communicate. So mostly in a room, you'll have one gateway and several sensors. And the good thing with the connection is that with the network, with the radio network, is that that signal can be even sent beyond a wall. So even if your newborn unit has different compartments and the device is in another compartment, that signal will still reach the router as long as it's within the specified distance. So all this data, so the sensors will collect data. For example, in 1 hour or 30 minutes time, then all this data will be sent to the cellular gateway. So on the gateway is actually a link. It's helping us to connect our data that we have collected to now a dashboard or the software that you'll see on your laptop. So once this information has been relayed to the gateway, to the cellular gateway, it will now communicate to the dashboard using cellular network, that is GSM technology. And all this data now, for me as an engineer or for you, if you have the credentials, now you can see the data on your dashboard. Another thing is you might be wondering, what if there's no power? In cases of power outages, what happens? Does it mean that my devices are not monitored? That I will not tell whether the device, whether there is power or not? So we also have a power monitor, a sensor that will collect, will tell us whether there is power or there is no power. And I think that is clear. If you have any questions, just keep them there or you can type them on the chat section. We'll answer them. So moving forward, still on the technology. So we are saying that Hadley sensors record the on and off state of medical devices. So they'll tell you whether the device, just as I said, they will measure the utilization. Has the device been on and was it in use? Or has it been off for the last 2 weeks or 1 month? Or even if it was on, for how many hours? For how many hours was it functional? And then the system shows alerts to biomeds to investigate. So whenever a device has been offline, So with this system, you can actually customize the kind of alerts that you want to get. For example, in facility a biomed will just want to know any device that has been offline maybe for 1 week, please give me an alert. Someone else will want an alert for power outages in case there's a lot of changes, like there's a lot of instances of power outages, and that unstable power supply can affect medical devices. So as an engineer, I may wish to get such kinds of alert. So with this system, you can set or you can customize the kinds of alerts that you need to get, something that works for you as an individual. So that in case there's fluctuating power consumption, even on the devices, it's something that you can tell as a biomedical engineer. And then from this data and from those alerts, you can always plan for maintenance, and you ensure that the needs are addressed, because you'll always be able to see that your level of performance, how many devices have been on, and you can tell which ones were affected by power or which ones have stayed for even over a month and they have broken down. So it's a good tool. As an engineer, you can actually plan yourself and for accountability purposes. So how does the dashboard look like? What do I get to see as the biomedical engineer? So for example, in this case, this is an image showing all the NEST facilities, all the countries that NEST operate in, and and individual facility data. But we'll just use this first slide. You can see that on the top tab, you can see that now this client is NEST. And NEST has data in 4 different countries, or let me say 5, because we have USA there, which is like a workshop. So NEST has data in 5 different locations. That is in Kenya, Malawi, Nigeria, and Tanzania. So if I'm an engineer, a NEST engineer in Malawi, of course, I'm just interested in my own data. You'll just click on Malawi, then you'll see now Malawian data being displayed. But for this instance, we can see that under NEST has been able to monitor like 375 devices. And at the instance when I took this screenshot from the dashboard, like 108 devices had not been used for the past 7 days. And of course, from my end, I've done follow-ups with the engineers to find out, is it because the gateways are offline so I can't track them, or is it because the equipments are actually down? And remember, I have Asset Infinity. So these two softwares actually supplement each other. That I have data from Asset Infinity, I have tickets. I can tell whether the problem is from breakdowns, because I will see the number of tickets, or rather, maybe it's a network issue. It's just that some of the gateways are not monitoring the devices. Another thing from this dashboard, you can see that from my end, I will see the current system status, like how many gateways are offline, or even the number of sensors that are offline. You can also see utilization changes and, of course, environmental status, because I'm monitoring humidity and temperature. So moving forward, this is the kind of data that you will see for humidity and temperature monitoring in NBUs. You can see that we have preset values or a preset range of where the temperature should always read. So it should be between a certain given range of temperature to another one. So you'll see the green graph displaying temperature, and then the blue one, of course, displaying humidity. And this is just for use to know that the sensors are functional, and also the NBU, you're able to maintain good temperatures and humidity for the babies, and also for the utilization of those machines. In terms of power outages, I mentioned that we have voltage sensors that it will detect whether there was a power outage or not. And also that will affect utilization of devices, because maybe at a management level, someone will ask you, how come 7 devices or everything, there's no device that was used on Thursday? But when you come to the data, you actually have a reason that there was no power, or the backup was also faulty, though. So this is just data. that can help you in making decisions and also in giving reports. So as we finalize, troubleshooting as a biomedical engineer, it's not every system will always have a problem. So in this case, since it's a communication system, one of the major problems is communication. You always have to ensure that all your components of that system are communicating. If they're not communicating, if your sensors are not communicating with the gateway, then the three LEDs will be red, as shown in the left picture. And if there's a successful communication, then it will be green. The three LEDs will be in green. And this is actually the very first step you take when you want to diagnose any problem with the system. Is the communication okay? Yes, then let's look at something else. So this is very fundamental to understand how the different devices interact. Then, of course, we have challenges, especially in most of the African facilities. There's a misconception that these kinds of devices are CCTVs. So nurses will always feel like maybe you're monitoring them, you're looking at them having tea the whole day. So it's a misconception that we have had to deal with. And of course, to empower them and explain to them that the system is actually here to help them, to ensure that they get good technical support, but not to monitor their activities because there is no video camera. And another thing, with that misconception, of course, some of them unplug the gateways, and it needs to be powered for it to communicate well. So some of them will unplug the gateways. And also, limited resources. Maybe they have less sockets. You'll find them unplugging. But in any area that we have installed, as you can see in this image here, we have extended a socket to the roof to ensure that no one can get there, and also we don't interrupt with the resources that they have, like the number of sockets that they use normally. Now we make another socket. And another problem is shifting devices. I mentioned earlier on that for the device to be monitored, it has to be within a certain distance range. So if this device is moved to another ward, then that means I will not detect it, and it might show that it is offline. So that has also been another challenge, of which we have found ways of dealing with it. Then lastly, all these systems have really been essential to us as an organization because we have been able to get data and information from our customers, who are the users, to the manufacturers to improve designs. So we've had a number of events where from the recording of tickets, from the monitoring, we noticed that there is occurrence of breakdowns, or there's a particular device that has a recurring problem. And we have been able to relay this information to the manufacturers, and thereafter they have improved designs. So it is very important to monitor. As I finish, of course, our main focus for us as an organization is innovation. And innovation is in terms of the devices that Khalid introduced earlier on, and also innovation in monitoring and tracking. We're in the era of digital. So as engineers, we should be now thinking ahead on how we can innovate in our organizations and enhance service delivery for the healthcare systems. Another thing is impact. We focus on impact with monitoring. We have been able to support more than 290 newborn units across Africa. And from next year, of course, we are scaling to other countries. And we know that we'll extend these services to more countries and help more people. And of course, sustainability. This is through capacity development and choosing devices that can withstand the environmental status in Africa. So thank you for that. We've come to the end of the presentation, and the floor is open to any questions that you guys have.
Thank you very much, Christine, for the question. Okay, so we have a question in the chat, and we have a hand from Sepi Adams. So I'll start with the question in the chat. It says, is the sensor on every piece of equipment? Is the sensor on every piece of equipment or selected categories of equipment? So to you, Christine or Ali. You can take this one.
Yeah, let me take that. The sensor is on select equipment, not every, because one of the criteria is the equipment should be using power. So you'll find that there are those small devices that are not using the mains 240 volts or uh, the mains power, that is. So there are those small devices that like the pulse oximeter, glucometer, which we cannot because it will not be ergonomically able to do so. So it's the main devices like starting, let's say, from the CPAPs, the warmers, the phototherapy, the incubator, those kind of devices. So for those very small ones, we are not able. And if the device is not able to use the mains power, then also we are not able to monitor it. So hope that answers.
Thank you very much, Ari. Okay, Christine, maybe you would like to just keep the presentation hanging. Maybe some of the questions might have to refer to the presentation.
All right, I'll share it.
Sure. So we have a hand from Sethi Adams. Sethi Adams, go ahead and ask your question.
I hope you're getting me. So I have a question in relation to CPAP. Can you kindly explain FiO2 in relation to SpO2 while using a CPAP? That's the first question. And again, I would love to know the lifespan of a CPAP because we have one from Nest 360. Can you help maybe in servicing or availing spares for equipments, especially those that are not from, let's say, Hatch Technologies? And also, I would love to know if the monitoring devices can only be used in your equipments or can also be installed in other equipments that are not from Hatch Technologies for use. Yeah. And in your monitoring devices, why have you limited yourself to humidity and temperature only? That's my question.
Those are 4 questions. I'll take some, Christine can take some. Just to add with, to start with, maybe the concept he has asked about FiO2 and is it pressure? Just Seth, you can.
SpO2,
Yeah.
FiO2 and SpO2, yeah.
Okay. Then I'll just explain it in a general way. Perhaps the terminologies themselves can help us. Especially in regards to our CPAP, you'll find that it has a blending table on top. And what that helps you is at certain total flow and at certain liters per minute of oxygen, what is the oxygen saturation in the baby? So FiO2 fraction of inspired oxygen, and the other one is SpO2. So here in regards to our device, what we normally set is, let's say, the oxygen source from the wall or outlet or the oxygen concentrator. So if you are setting it at, let's say, 3 liters per minute, what sort of saturation are you able with this baby? So there is that blending table. Actually, it is in the Nest website and the command user manual, if you have it. So how it explains is, if you set an oxygen source of, let's say, 3 liters per minute and a total flow of 6 liters per minute, and then you're able to get a saturation of 50%. That is the SpO2, the saturations. Then at certain level, so if you want to increase to 90%, you'll increase the flow to from 3 liters, you'll go to 4, 5, and also as the flow, total flow, that is the combination of air and oxygen increases, you'll be able to get such saturations. There's actually the videos in the NEST website are able to explain this much. It's a whole lot of topic how to use the blending table, but it is well explained in the video. You can also actually get to us, in touch with us directly in email. We can help you more on that. That was the first question. If I pick on the question on why we are only monitoring temperature and perhaps humidity, first of all, we are measuring the utilization, device utilization. I don't know if you got that. So the sensor is able to measure the device utilization of the device. Then the second thing is we're asking ourselves, is there any environmental issues that happen in the newborn unit? So this could be in the form of high humidity. This could be form of high temperatures, or let's say those areas which experience winter. Is it very low temperatures? So those are the ones we're able to monitor. And now we have added power outages, power surges. So I think those are the key ones which we're able to identify. And of course, there's a chance for improving further the device. Christine, you able to take the other two?
Yes, yes. Also, just to add on why temperature and humidity, as Ali has mentioned, that as Nest 360 and as Hatch, our focus has mainly been in newborn units, and that's why we've been measuring temperature and humidity, because those are the two important parameters in an NBU. But in case now you want to use the same solution in another area of the hospital, you can still measure any other environmental aspect that you'd wish to, because there are sensors for all those things. And the question on whether the solution is only used for Hatch Technologies equipment, no. You can use it for any other equipment that uses electricity, as Ali mentioned. So it's a solution that can work for any other medical equipment.
Thank you very much, Kristen. Okay, so we also had another question in the chat, and the person was asking, how much does the sensor or monitoring system cost per facility? How much does the sensor or monitoring system cost per facility? I'll read another question because of time. So the other question was, after conducting a ppm on oxygen concentrator, but the purity remains 67% instead of 82, what is the cost? I don't know if you deal with oxygen concentrators, but if you can take that for us. If not, you can let us know.
So for the cost, actually, it is driven by different factors. That's the number of first of all facilities that an organization wants to monitor. If it is one facility, two facility, three facilities, and then in the same facility, how many devices do they want to because we give it as a package. So what I will advise best is we can leave our emails or in the chat. Then we can take it up on a one-to-one conversation on how best, because it normally varies from one side to the other. Installation, then there is also the communication part. Which country are we installing this solution? How easy is it to, to set up the communication, the SIM cards and all that. So we'll want it to be a one-to-one conversation and see we want to offer the best, the most effective solution for that scenario case. Then the other part about the saturation of the oxygen, there are many causes, but the most one important one to check will be the sieve bed, how long it has been used, because they have lifespan. If, for example, the concentrator is going towards the third year, however much you try to service that device, the sieve bed will only have some sort of lifespan which you cannot go past. And it will also depend from model to model, manufacturer to manufacturer. But so far, the ones which have the longest lifespan we have seen actually in Malawi, almost more than 5 years. The oxygen concentrators running the AirSep ones, and of course their costs are much more. but you'll find you'll want to check whether the sieve beds are intact. Are they almost their lifespan is almost over? So if then you're able to get replacement sieve beds, that then you can change them. The other thing is also to check, the compressor, are the rubber ceilings and the silicone parts, are they intact? Are they worn out? Because it can be creating leakages and all that. So, but the thing that is creating, contributing mostly to the purity of the oxygen is the sieve beds. So I think it will be something to do with the sieve beds.
Thank you very much, Ali. Okay, we can get it. Our last question from Aubrey. Aubrey, go ahead and ask the question.
Thank you very much, Sharon. First of all, thank you to Christine and Ali for the great presentation. I have two questions. The first question is about the user feedback on the Kanta oxygen concentrator. Just wanted to know what kind of filter paper do you use to replace the sievebed filters? Because it's something that we've met in the field when we're fixing some of the Kanta oxygen concentrators. Another question is, we have noted that most of the Kanta oxygen concentrators have damaged oxygen sensors, and it doesn't matter if the machine is brand new or not. We have noticed that usually most of the oxygen sensors have a leakage, have cracks. Is this something that you guys have experienced it? If you have, what are the systems that have you put to tackle this problem? Are you in touch with the distributors, or what have you done so far? Thank you.
Christine, you can take it.
Hello, Ali. Ali, can we take that one?
Yeah. So let me get straight to the oxygen sensor one. We have not seen that challenge, but the challenge we have faced with the Kanta concentrator is that it is having sieve bed leakages, such that the zeolite is leaking from the sieve beds. But this comes normally after what we have noted in the 4 countries is that normally comes after 6,000 working hours and not a brand new machine. So it could be a peculiar issue which we would like actually to know. So perhaps I'm just trying to think of what the cause of that could be, is if there is any powder zeolite that escapes the sieve beds, it could go on and damage the sensor. That's the only explanation that I could have for that now, because we have noted that there is some scenarios where the sieve bed, the zeolite leaks from the sieve beds. On the part of can you remind me the second question, the first question, sorry?
What type of filter paper do you use?
Filter paper, yes, yeah. So the filter paper is we get actually from the manufacturer Kanta. We are not sourcing it locally. I don't know if you can go back to the picture, Christine, showing the Kanta concentrator. Yeah, so it's that actually white filter paper that the person is holding there, and we get it from the manufacturer. We don't get it locally, but it's sort of paper and sort of cottonish. If you have a touch on it, it's very cheap actually, and we have gotten large numbers of it in the countries that we are working with. And if you have a large number of installations, then perhaps you can talk to Kanta and see how this can be provided, because these are rectification actually from the manufacturer side. So we can get in touch with you on that, on how to get this filter papers.
Thank you very much, Ali. Okay, so hitting at this point, because of time, I would like to thank you all for joining us for this partner talk. So if you have any questions, please, you can send to our email, info@oxygenalliance.org. But I'd like to thank Ara and Christine from Hash Technology for making time to share with us on reducing medical equipment downtime and equipment graveyard with comprehensive technical support. So I hope this has been very helpful. So if you'd like to get updates and notification on the upcoming webinars by Oxygen Alliance, please do share with us your email address in the chat. Then we can add you to our emailing list. So until next time, it's goodbye.